it's not just understanding the surgery, that is important. It's being in the right psychological space to actually go ahead and do it. But it's also the physical side of it. This is not lunchtime surgery. It may be packaged as a holiday. It may look glossy, but it's actually real surgery, and it needs to be prepared for and looked after afterwards, the same as any other surgery. Some of these procedures are very long procedures. They can take 6 hours. And if you have any health concerns, that adds to your risk. No surgery is risk-free. It doesn't matter who's operating or where. There are complications associated with any surgery. Yeah. They should all be gone over in advance in the consultations. And if someone's risks are high, I'm just going to give a few examples. For example, if you are diabetic and your blood sugars are not well controlled, well, that should be dealt with first and then have the surgery at when things are at a safer level. Or if you're considering 2 surgeries, maybe you're not suitable to have them both together, yeah. You know, if you're considering 2 different areas. If someone's heavily overweight, and this is not for bariatric surgery, this is for cosmetic surgery, plastic surgery. If someone's significantly overweight, that puts their risk of healing problems up as well. And not only does it put their risks up, their results are not as good either. It's not meant to be weight loss surgery. It's meant to be contouring or shape enhancement surgery, not to get rid of excess weight. Okay, let's move on to our next viewer question. We always talk about Turkey, but how many botched cosmetic surgeries are there in the UK? So it's the difference, I guess, I'm going to be slightly pedantic, but it's important. There's a difference between having a complication and having something botched. Yes. Because the best surgeon and the best surgical procedure in the world can still have a complication. It's how it's looked after afterwards, that's, you know, how it's explained beforehand and looked after afterwards, that's what makes the difference to the patient, and how the patient's prepared and selected for surgery. A botched surgery is where something's been done wrong or not done enough. And the truth is we don't have an all-encompassing figure for the UK. We still, you know, we are involved as an organisation in BOPS in the UK, pushing patient safety as well, and surgeons trying to make sure patients know what to look for in a surgeon. So complications do arise in the UK. We have a problem in the aesthetics side of things with underqualified practitioners performing procedures here too. So it isn't exclusive to overseas, but at least you don't have the overseas travel component to access aftercare or to get back to contend with. I can't give you a precise number, I don't think anyone can, but I would say it is a problem in most countries that haven't completely controlled specialisation and registration and regulation of cosmetic surgery and aesthetics. We do see it here, but we can tell patients here what to look for in terms of surgeon qualifications, clinic regulation, clinic registration, what they should expect in terms of consultations beforehand, aftercare afterwards. And it's also important that a patient knows the individual terms and conditions or contract of their treatment as well. Ellie, you spend a lot of time with Sarah, for example. You know, from what you understand and from what, you know, the conversations that you had with her, how much clarity does she have in terms of, you know, what Dr. Nugent has just articulated to us there? I think the pre-surgery consultation, the awareness of particularly the risks that are involved in the surgery isn't always stressed, shall we say, depending on your clinician in Turkey. A lot of it is to do with selling the dream, the results, the post-surgery images, and those kind of risks and potential complications at any scale aren't always sufficiently explained to the patient beforehand. I think it is important to say that there are, of course, many excellent surgeons in Turkey, and surgeons in the UK I've spoken to say that many of them also perform the same procedure so regularly they become experts in that particular domain. But of course, when things go wrong, they can go very drastically wrong. Yes. Well, that point there leads us nicely to the next viewer question. Is there a difference in the medical qualifications needed to carry out these procedures in Turkey compared to the UK? There is a standard in Turkey that a specialist plastic surgeon needs to meet, but it is different to the UK. You know, we have a set training in plastic surgery, and for someone who trains and works in the UK, by and large, we have surgeons coming in from overseas as well. There's a training program, an exit exam, and essentially a qualification in plastic surgery and a specialist registration with the Medical Council. There are equivalent qualifications in Turkey. They're not exactly the same. But what patients should realise about overseas travel is that not all countries have the same training programs or the same specialised qualifications for plastic surgery. Every country is slightly different. Some countries don't have an exit exam. Some countries don't have a formal training program. There is a European-wide exam, but individual country exams can be a higher or a lower standard to that EBOPRAS European exam. So one of the problems is not that all surgeons overseas are bad. There are world-renowned surgeons and excellent surgeons, but one of the problems is it's hard to know, are you getting one of those surgeons or not? How do you know that's your surgeon? How do you know you have a reputable surgeon? How can you check it?
Yeah, when online, you know, people are able to delete negative reviews, people are able to make sure that their branding and their content all looks completely professional and it draws you in. It's really difficult, I think, when we're asking people to make sure they do their research, make sure they do their homework, when actually that content online is really hard to cut through.
It's curated and it's marketing content. It's not necessarily a list of someone's qualifications, and even if it was, how do you know those are the right ones? There are specific qualifications for each country, but if you're travelling not knowing what to check, you have no idea whether your surgeon has those or not.
I will say the Turkish embassy does have a search function through its website where you can look up hospitals and clinics, and that's a sense of reputable sources of information.
We have contacted our Turkish counterparts, the Turkish Society of Plastic and Reconstructive Surgery, and they have given us an outline of what a reputable Turkish surgeon and clinic should. I'm saying Turkey because that's the most common location for UK patients. But they have given us an outline, and actually we have put it on our website because so many patients travel, about what to actually look for that will tell you this is a reputable surgeon, a properly trained surgeon, this is a reputable clinic, you know, what kind of things to look for. And some overlap with what we've talked about earlier.
Well, that is the next question, Dr. Nugent. Quite a few people have been getting in touch to say, you know, in the main, their experiences in Turkey has been a positive one, but it seems this is somewhat of a lottery. How can you tell if the clinic is reputable?
So I'm just for a moment going to say that we have put a guide on the BOPS website where we have specifically asked the Turkish Society to list out things like that, and it's things like making sure their surgeon is a specialist in plastic surgery, the number of years of experience they have, that the clinic is registered with the Turkish Health Ministry. So there are things like that to check. But I would also say complications can happen with any surgery and any clinic and any surgeon, reputable or not. So it's also about thinking about how you would access aftercare and what you would do if a complication happened and you've come back home. So it is the qualifications, but it isn't just the qualifications.
On the matter of compensation, on the matter of funding and cost, this last question, what should someone do if they want to seek compensation for surgery that has gone wrong?
Okay, so this is after the fact, so they've already signed up for it and had a complication. I think number one, check all the paperwork, and on that point for paperwork, it should be in a language that you understand. You know, if you don't speak the language, how can you properly sign something? So all the terms and conditions of treatment, so you know what was agreed in advance that will be covered or not. First port of call will be to contact the clinic or surgeon directly, because they were the clinic or person that you had your agreement and your arrangement with to carry out surgery, and that you trusted to carry out your surgery and look after you afterwards. That's the first port of call. And some patients have got some satisfaction out of that route. Not everybody has, and some people don't have a good way of contacting the surgeon or the clinic. And then it boils down to honestly looking to see if they want to take it further legally. But you're in a different jurisdiction, so that's difficult.